The story is worth your attention. Gauteng Health MEC Dr. Bandile Masuku and Health Minister Dr.Zweli Mkhize are due to visit George Mukhari Academic Hospital today.
Yeah, the healthcare system in that province is currently under the spotlight because of an ongoing surge in COVID-19 cases in Gauteng. The province recently broke the 100,000 infections mark. Newzroom Afrika's Sipha Kema is outside the George Mukhari Hospital ahead of that oversight visit. Sipha, this hospital important for very many reasons, not all of them good.
Well, that is true, Michelle. As we know that recently this hospital came under the spotlight when a 2-year-old was raped whilst in isolation, which of course shows that a security breach. Now, many people have asked themselves the question whether would this be an issue with the security breach, negligence, or maybe the shortage in staff personnel is what led to obviously the rape happening. And also, why was this 2-year-old girl put aside in isolation on her own? So of course those are some of the questions that were asked to this hospital as well as to the health MEC himself. Now of course, Michelle, we know that today we are expecting them at 9:30, the minister and the MEC, to take a tour and evaluate the state of readiness of the hospital, as they've done so with Tshwane District Hospital. Now the reason why they're also here is because now there's been said that there's a shortage, it's been reported there's a shortage of beds in the province, but of course that also quarantine sites such as Nasrec as well are receiving an influx of patients, which is a concern. And of course, while some cases might not be so severe and only mild, it's because the majority of people who are already admitted are those who cannot self-isolate or self-quarantine. But of course, Michelle, this hospital, not only the state of readiness will be under the spotlight. Now, this will be the first time the minister will be visiting since the rape of the 2-year-old girl. So there will be some, of course, questions that will be asked, especially around security and the tightness of security. I mean, we also observed early this morning when we came in here how tight the security was here at George Mukhari, where we saw that they seem to have deployed a lot more security at the gate, and also the searching of cars was more intense than previously. But now we don't know exactly how the security is inside of the hospital, as we've had to wait outside. But we will be able to give you more updates once we go inside with the MEC as well as the minister at 9:30 when they start, of course, their tour of the hospital.
Yeah, so Sipha, you've been outside that institution for quite some time, since the very early hours of this morning. Paint the picture for us about, I guess, the levels at which there's traffic there. I mean, we've seen various reports about how hospitals are inundated with patients coming in and out, and the sense that you get of whether or not there's a good handle of that traffic, whether the situation appears, at least from the outside, to be under control or not.
Well, as far as the traffic of going inside of the hospital, I mean, we did see a number of cars, but we cannot confirm whether those are patients or maybe hospital staff. But there were quite a number of cars early in the morning coming in. For now, it is quiet, so which shows that that was staff personnel. We also tried to spot if there were any ambulances that were going in here, maybe for trauma unit, casualty unit. But so far, since we've been outside, there haven't been much. But there's been a lot of pedestrians. I'm sure, I don't know if you're aware, but George Mukhari, right next to George Mukhari, actually right in front of me, is a taxi rank. So majority of the patients that have been coming in have been walking in. And I just want to show you, I'm not sure if we're able to show you the line here. That's actually here. There is a line, a long line that is coming from inside, using the pedestrians from outside of the taxi rank going inside the entrance of the hospital. Now this shows you that the line is here not because there's a lot of people, but because of the stringent security measures in place currently to ensure that people have their hands sanitized, they have their mask on, but also since the rape of the 2-year-old girl, they've had to ensure that they have enough security, that they've beefed up the security at the hospital.